all of you are here today because you know we have the potential and the ability in this community to make things happen. And based on what we just heard from this panel, I want you to remember two things. We talk a lot about, hey, Canadians need to shout more from the rooftops in terms of getting recognized. We're too humble. But let me tell you that the fact that we have international groups willing to tap in to this group here means that we are getting recognized. There are some interesting ingredients here that people around the world are saying, hey, there's something happening here. So we're getting that. But I want to take Corey's point. I don't know if he's still here, but we need to do something about that. We need to act on that. We need to show some successes. We need to demonstrate our capabilities as quickly as we can, have that sense of urgency to move forward. The other thing I will mention is that these groups, these other people that have tapped into us, whether it's Joanne in the Valley, Rob from Ottawa and BioTalent, or those international folks, they're here to support us and help us. I mean, they're part of our extended network. So remember that. So I'm going to be introducing Chris Carvalho to you very soon. He'll be your conduit. If you want to get connected in with the European Connected Health Alliance, chat with Chris. We can set that up. They're looking at Canada. Who was it that was saying that, Karen, that people, when they meet Canadians in international conferences, they kind of look at us and go, oh, they're really nice people, right? But we're not really playing on that global stage. So they want to work with Canadians because we're nice people. They have a really good opinion around Canada, but we need to be more aggressive in terms of where we want to go with our technology, where we want to go with our companies, how we're looking at financing resources and all those kinds of things. So I just wanted to bring that up from that perspective. Let's take a look at just a couple of trends before we get started, just to get a sense of where we need to go. So in the digital health space, which is where all the money is going into now, and you might remember myself speaking, Corey and a few others are saying that this is where the new health economy is going. It is the fastest area of investment right now, right? $11 billion a year ago. We're tracking to break that again in 2018. All the data is not in yet. This is where a ton of the money is going into. This is where there's opportunities for our companies to jump into. But you have to understand, this is a global market space. Look at all the countries that are playing in this space. Look at all the countries that have companies that are in this space, right? And then look at how Canada compares to the rest of the world. Right? If we look at unicorns, right? Do you guys all know what unicorns are? The $1 billion club, private companies that are worth $1 billion. Yeah, Canada's on the map. We've got countries like Sweden on the map as well. But take a look at Asia. Take a look at India. This is US, 1 billion, right? Take a look at China. We can't arrest all those CEOs. These guys, right? These are our competitors. These competitors are joining up with the incumbents, the brand names that you know, and are selling to our health jurisdictions across Canada right now. Those are the guys we're up against. So we need to roll up our sleeves. We need to get moving, and that's what Chris is going to help lead us do here with our working groups. I just want to mention one quick thing of some people have asked, how do you get involved with Health City? One of the ways is the working groups, and so we'll talk a lot about that. Chris will tell you how you can get involved. But a second way is we want to spark this sort of ability for the ecosystem to get together. And so we can't do it on an individual peer-by-peer basis. So what I ask of you is if you have an issue, if you have a concern, or there's an initiative that you'd like to drive, instead of contacting the board, contacting me directly, get a few of you together. Build out what that initiative is or what that policy driver that you're looking to move is. Bring that to Health City. We will host that table. We will try to move that initiative ahead. When we talk about government, there's one last point I want to make. A lot of times we think of government, we think of how do we get money out of government, right? Well, I'll tell you, our biggest challenge right now is actually policy. That is what's preventing us moving forward in this sector. So when you see that there's policy changes that we need to make in terms of enabling business around where the new health economy needs to go. Let's band together. Let's figure out what those policy changes need to be, and let's communicate them to where we need to go. We have the support. Jason and the board have told me that the board will support these types of initiatives, but let's bring them together. So I'll introduce to you now Chris Carvalho. We're really pleased to have Chris with us here. I just want to give you a little bit about his background. So Chris, health informatics specialist, certified project manager. He has his PMP, has tons of international experience in large system transformation, multiple industries, healthcare, banking, as well as the private sector. Experience in clinical system implementation, EMR, digital health knowledge. So this is the guy we want leading us here in terms of where we want to go with the working groups. And Chris, over to you.
Great. Thank you very much, Reg. I got to get you to come to all my meetings and give a little hype intro before we start. So appreciate that. So based on what we've heard today, I think there's a lot of great examples of everything that's happening globally. I think even the fact that we're able to link in folks from across the world shows some of the collaboration opportunities that are possible. So I am going to switch things up slightly because maybe it's because I saw Tony Robbins a few weeks ago and feel I'm qualified to go off script. So sorry, Karen, but can everyone take a look at the papers that we just distributed out there? These are the 4 working groups that we're going to be talking about today. But before we get into actually explaining what we have in mind in terms of the activities, I'm just curious on what your guys' thoughts are. So go ahead, quickly jot them down, whichever one resonates with you first. I'll give you about 30 seconds to do that, and then we'll get back to the presentation. And I do apologize for those that are live streaming in. I know we've got some texts about that, so we will get back to the content shortly, but start thinking about, what can we do today based on what we've heard. Okay, I know that's not a lot of time, but we'll get back to the work in a second here. So first of all, in terms of the working groups, what I do want to say is that, we do have to recognize that there's multiple successes that we need to build off of. We've heard great examples of that locally as well as globally. Even the working group efforts that have taken place over the last 2 years to gather the information and validate what's important to the ecosystem is stuff that we can build upon. What we want to do now is focus on those priority growth areas. Many of you have talked about it already, so the 4 working groups that we have in front of you should not be a surprise. Talent, data, making smarter decisions, access. We're not reinventing the wheel. We're just trying to put some focus around some of these key priority areas so that collectively as an ecosystem, we have a better direction that we can work to together. So the idea here, and me as a project manager, love to get the plan in place, but also how do we get to action? We're joking around earlier, get it done, but there's 2 important letters that should probably be added in front of the it. So we need to make sure that we're really moving forward together. So the working groups, in no particular order, what I do want to go through here is sort of what we're thinking as some of the key focus areas, but we will move into a bit of an exercise where we're going to ask you, where should we start? So we can start with financing for impact. We've heard, time and time again throughout this presentation and many of the other sessions that you've likely been at is that there's tons of money being invested in multiple areas in the new health economy. So how do we become smarter with bringing investors in? How do we become smarter with community-based investments? How do we look at different funding models so that we're co-investing, risk sharing, matching funding to bring and attract those appropriate people locally here? Lots of different places that this can go, but really the focus is tapping into that large pot of money that's available, but also growing that pot with Canadian content and specifically local content. The next one is target to market, and really what this essentially is all about is identifying what those new and emerging areas are in the new health economy. So how do we put money into or resources into growing those, identifying those, and building some infrastructure around that so that we can compete with those unicorns that are out there, that we can leverage the already existing experience that we have here, but grow that exponentially and accelerate that into the economy. Part of that is also taking a look at, our IP policies. How do we help to support the researchers and inventors so that they're able to take IP out of the academic and public institutions and accelerate that into the economy? Talent works, certainly a very important point that we've talked about a lot today. We can't do this without great people, but how do we take the numerous new grads that are coming out of our institutions every year, highly trained, and giving them the experience that they need locally? If we can't provide that locally, how do we build partnerships so that we can give them the opportunity, but then also attract them back? I think there's a few examples, where they may have left, but they want to come back to this ecosystem because there's the ability to get that experience and integrate into the system. So. As well as retaining them. Once we get them back here, how do we continue to provide new opportunities to be able to do that? The final one is powering smart decisions. And I think a lot of people's mind go to data, but I think it's more than just the data. It's how do we build out effective toolkits to make informed decisions. Whether you're a clinician looking to gather and take all these siloed data sets, turn it into information, but also where's the clinical utility behind that? If you're a patient, how do you take the wearables and the consumables and pretty much any other able that there is out there and be part of your care? If you're an investor or you're a service provider, how do you use the data that's out there and make sure that we're investing or disinvesting in the right areas? So all of this does come back to making sure, and I think it was Corey that said, we don't want access to everything, but what are the key elements that we actually do need to take a look at to find out if our models are even accurate, if the data that we're requesting is even something that's going to be viable. So that's just the very, very brief overview of what we're hoping to do as part of the working groups. This is the first wave. It's really meant to test the model. We want to be nimble. We want to be flexible. We want to make sure that it's representing your voice as an ecosystem. So the important thing is that we start somewhere and have that focus. Very quickly, because I love Gantt charts, the action plan that the board's expecting from us is due in September. And I say that because we really only have 8 months or 200 days. And not a lot of time, right? It may seem like a long time, but we have 200 days to act now. So aggressive timelines, but I think the important piece is that they're asking for an action plan, but they're also expecting some results to happen over the next 8 months. So it's not going to be good enough for us to come back and say, here's what we think we should do. We should also be able to say, here's what we've also done in the last 8 months collectively. So we do need to make sure that after today, we're going to be going out and recruiting for the working groups. We're also going to be recruiting for a chair that has deep expertise in each of these areas that we've identified. But then also we need to make sure that once the initial working groups start, we need to have regular touch points with the ecosystem to make sure that we're on the right path. So again, you guys made my job very easy because we've already talked about a lot of these things today. But that's the most common question that I get as I've been starting to talk to many of you about how to get involved is, excuse me, how can we help? So I like to use the word we because it has to be all of us together that are going to be moving this forward. So commitment is the first piece. I know many of you probably came for the bacon, but I'm glad that you stayed for the conversation. So that shows commitment. Mutual trust and accountability. Again, we've talked a lot about the trust that is going to be needed to move some of these things forward. So I'm certainly excited to see a lot of the conversations that are already occurring. It is going to take some patience. Some things we do might not be right the first time, but as Badea said, we have to fail fast so that we can adjust and move forward. Collaboration is also going to be key, and I think it's collaboration with some of those entities that we might not normally think about. How can we take expertise outside of healthcare and collaborate with them to solve healthcare problems? Because I don't think ours are that much different. And I think it's also going to take some gratitude. So there's many people here that have been part of the ecosystem for a long time, so I think we need to thank everyone for their contributions. We also need to be thankful for the fact that we have so much support, from the city of Edmonton and also provincially to move some of these things along. We have to be thankful for, even if it's a small contribution, just be happy that people are willing to come to the table and put their ideas out there. I think that's a really important point to build that ecosystem. And the last thing is action. Regardless of how big or small, the important point is that we keep progressing and we keep moving together. So I think I've gone over. My apologies. But what we'd like to do now is actually get you guys to do some work. So I know you've been sitting for a while, so maybe just stand up quick. Stand up just to make sure everyone is ready to go here while I talk. Shake your hands out. I won't make you dance or anything like that, but what we're going to be doing now is we're going to be going over a series of questions, and it's really two key questions here. We're really looking to you guys to put the framework in place for the working groups to say what is reasonable for us to be able to do in the next 90 to 120 days. I think there's lots of factors that we have no control over, a provincial and federal election that are going to be upcoming. So try not to think about, what's stopping me, but rather what can I do? So that's going to be the first piece is work together at your tables. We try to get the colors going so you might not sit with somebody that you normally do. Hopefully that'll spark some of the conversation. If a few people have left, feel free to, make bigger groups. You can focus on one of the working groups. You can focus on all of the working groups, but just make sure that you're having the conversation. So as I said, the first question is, what can we do in the next 90 to 120 days? We're going to be using this information to help to build some of those plans, but also what all the other organizations need to be involved. And I would actually expand this to what other stakeholders need to be involved, because I don't think it has to necessarily be an organization, but maybe a patient group or something like that. So those are the two pieces, and we're going to spend the next 40, 30 minutes. We'll see how 20. So work fast, be efficient. And we'll have some members of the Health City team walking around if you have any questions about what the process should be. So thank you.